There are two kinds of alcoholics. There's a Cloninger type 1 and a Cloninger type 2. The Cloninger type 2 is the more severe and the more dangerous one, because the Cloninger type 2 people start drinking in their teens, and by the time they're in their late teens, 19 or 20, they're full-blown alcoholics and often are dead by age 23, 24. Because once they start drinking, they cannot stop. Every time they start drinking, they go on to full-blown inebriation, and essentially they pass out, they develop blackouts, they just cannot stop. Now, the Cloninger type 1 alcoholism is characterized by people who are social drinkers initially, and they can control it for a long time. There are the people who are referred to as the functional alcoholics. Of course, that's a misnomer, because they are functional up to a point. They're functional until they're no longer functional. In other words, eventually it gets away from them. There's no such thing as controlled drinking in a person who's alcoholic. Sooner or later, the drinking gets away from them, and it begins to affect their work life, their social life, and their personal lives. And the the operational definition of any type of addiction is a continued use of a substance despite adverse consequences affecting a person's personal, social, and occupational lives. And so even with the functional alcoholic, which is a Cloninger type 1, ultimately it goes to the point where they can no longer control their drinking.